non-operative management treatments for osteoarthritis. So, your joint cartilage is worn out. Now what? Unfortunately, there is no miracle pill or injection to regrow cartilage, despite what social media or supplement aisles might suggest. But here's the good news. We do have options. From lifestyle changes to cutting-edge therapies. Let's cut to the bone. I'm Dr. Lucius Pomerantz, orthopedic surgeon and lifestyle medicine physician, and today we're tackling one of the most important medical issues globally, osteoarthritis. This affects hundreds of millions of people globally and accounts for billions of dollars of cost to society. This video is part 2 of 3. A quick recap of our last video. We talked about articular cartilage, how it caps the ends of our bones to allow smooth movement. It's more slippery than ice, but it has no blood supply. So once it's injured, it can't heal. As it breaks down, you get bone-on-bone grinding, inflammation sets in, and that's osteoarthritis. Our joint cartilage is nourished by motion, and it is affected just like any other organ in our body by inflammation. So making changes in your life to reduce that inflammation will be crucial. A big part of that is moderate exercise. While we can't regenerate articular cartilage yet, we can reduce pain and improve function. This video will be looking at the non-operative ways in which we can tackle osteoarthritis. So first, let's start with lifestyle. These are the fundamentals. Lifestyle changes not only help prevent arthritis, they can help treat it too. Weight loss is a big one. When you walk upstairs or jump, your knees are absorbing forces up to 4 times your body weight. Drop a few pounds and that load goes down dramatically. Even if you're only taking 1,000 steps in a day, the few less pounds your joint sees adds up quickly. Add in the fact that obesity increases systemic inflammation, and it's clear why weight management matters. I've seen patients go from barely walking to active again just by losing 20 pounds. Results may vary, but it's a game changer. As we mentioned, exercise moves the joints, and that is how our cartilage is nourished. Along with exercise, there should also be nutrition. Less sugar, more whole foods, maybe a plant-forward diet. Those processed meats can really increase the inflammation. All of these changes can further reduce joint inflammation. Then there are other pillars of lifestyle medicine, including getting adequate sleep, 7 to 8 or 9 hours a night, reducing stress, I get it, it's complicated, social connections to help you feel better and hold you accountable for your life changes, and cutting out the bad habits like smoking, alcohol, and processed foods. I know, it's all easier said than done. You know you need to do these things. Consider this a doctor's prescription. Go out and control what you can control. The other options are pain, disability, losing function, and undergoing surgery. Now supplements. Let's talk about supplements. These are supplemental to your health. They do not replace good nutrition, exercise, a good night's sleep, etc., etc. They can provide a little boost, but keep in mind there is minimal regulation on supplements, and you should be cautious about putting anything into your body. Always consult a physician before starting a supplement. One of the most researched supplements for osteoarthritis is glucosamine and chondroitin. Often these two are combined. They're part of the crucial structure of articular cartilage, the proteoglycans, which help cartilage retain water and its overall structure. These contribute to cartilage being able to prevent shear forces and act as a cushion. Sounds great, but your digestive system has a say in how glucosamine or chondroitin gets broken down and then dispersed throughout the body. Once they reach your joints, there is no proof that they are doing what we wish they would be by regenerating cartilage. The largest studies show no consistent benefit to taking glucosamine and/or chondroitin. Smaller ones hint at mild anti-inflammatory effects, but there's nothing definitive. If you are allergic to shellfish, you may want to have caution, as many of these glucosamine and chondroitin supplements are derived from shellfish. The supplements Turmeric and its active compound curcumin show some more promise. Some trials suggest curcumin may match non-steroidal anti-inflammatory medications, like ibuprofen, in pain relief. Just keep in mind there can be interactions with other medications and that nothing is regrowing your cartilage. So, non-steroidal anti-inflammatory drugs, NSAIDs. These are ibuprofen, Motrin, naproxen, Aleve, meloxicam. These have been shown to reduce pain and inflammation. They are cheap and easily accessible, but they can be hard on the stomach and kidneys, and they're not meant for long-term use. Some NSAIDs have other drawbacks, increasing the risk of other medical problems, even heart attacks. Use with caution and always with doctor supervision. Injections. This is a broad category, but it makes sense. What if we put medications directly into the joint that's angry? Well, there are certainly some out there, one of which is hyaluronic acid injections. This goes into the category of viscosupplementation, with the aim to restore the slippery, shock-absorbing quality of joint fluid. These may help some people, often younger with only mild arthritis, but studies show mixed results. Think of it as oiling a rusty hinge. It could be helpful to get movement going if there's still a hinge left. Another type of injection, corticosteroid injections. These are steroidal anti-inflammatory medications that we put right into a joint. Classically, cortisone. We don't actually use cortisone anymore. There's others that are less harsh on the body. And these are the gold standard in which we compare treatments. They calm inflammation and pain, often within a few days, and their effect can last weeks to months, but they're not without downsides. Too many injections can weaken cartilage and other tissues around the injection site, and, for example, can cause skin or fat atrophy. I usually limit a patient to 2 or 3 injections per year to a particular joint. If we're getting to that third injection within a year, it's probably time to consider other options. Some common myths about steroid injections. Steroid injections won't give you diabetes or make you fat or destroy your immune system. Long-term oral steroids can do those things, but we're not talking about those here. Then there's the category of biologics. And, well, I'll just hit this with hype versus hope. Let's wade into the murky waters of biologics. Platelet-rich plasma and stem cells are the more common ones that you'll hear about. Stem cells do include bone marrow aspirate concentrate, BMAC, and amniotic tissues. Platelet-rich plasma, also known as PRP. This is made from your own blood. It contains platelets, and these are the initial cells of our healing response to trauma. They contain growth factors that may stimulate healing. The studies that are out there suggest PRP may benefit, but primarily in younger patients with early arthritis. It's not FDA regulated and results seem to vary. Then there's stem cells. Ah yes, the potential holy grail. Cells that could potentially turn into anything, including articular cartilage. But that's the dream. In reality, we don't know how to direct them. Most stem cell treatments provide only trace amounts of actual stem cells, and most amniotic products, 0. We also don't know how to make those stem cells become the chondrocytes making articular cartilage. This is a very complicated developmental process. It starts as an embryo and goes all the way through adulthood. They're like tossing seeds on concrete and hoping for a forest. These treatments are still experimental. At worst, they're expensive, false hope. I've seen patients go into debt chasing a cure that doesn't exist yet. If someone is promising a cure for your arthritis, either they are withholding a secret that would make them billions of dollars and win a Nobel Prize, or they are lying. I can understand the excitement about stem cells. They have a ton of potential. We are just not there yet. The bottom line, as of today, there's no proven way to regrow cartilage in an arthritic joint, but we can reduce pain and improve your function with lifestyle changes, supplements, medications, and injections. Each option has pros and cons. Know them, weigh them, and talk to someone you trust. Always have a doctor involved. Thanks for watching this episode. If you found this helpful, gently tap that like button. Subscribe for more straight talk with orthopedic content, and share it with someone who's battling joint pain. And as always, stay strong, stay smart, and stay in the fight. I'm Dr. Lucius Pomerantz, orthopedic surgeon and lifestyle medicine physician. Also, check the notification button so you do not miss the next episode about osteoarthritis, which is going to include surgical treatments. It's the last of this series. Thank you again for your time.